So, what are the best ways to prevent heart disease at any age?
Yeah, that's a very common question. So I could tell you from experience working in a hospital that I've seen men in their 30s with heart attacks. I've seen men in their 40s, 50s. It doesn't really matter the age. I even had a 28-year-old who come in to the hospital with heart attacks. So first thing is to understand your family history. I think that is usually the number one thing. And really understanding, there's one particular question that we like to ask. We like to ask if anyone before the age of 50 had a heart attack or massive heart attack in the family. That increases your risk threefolds for having a heart attack as well. So that's something to be very mindful of. The second thing is to understand your habits, right? So what are we doing in terms of your eating habits? Are you eating drive-through, something every day? Are you eating late at night? How are you managing your stress? So all of these types of things are very important. So if you can manage your stress better, if you're eating at least 3 hours before you actually go to sleep, making sure that your heavy meals are not too heavy at nighttime. So all of these types of things, these are modifiable things that you yourself can do to decrease. And third, smoking and slash drinking. I'm going to put drinking in there. So any type of drug use that I like to put in there. Um, so nicotine usage. So the vaping pens. I know people
Oh my
kind of
goodness, though I see it everywhere now.
everywhere, and people don't realize that when I say, hey, do you smoke, I don't actually ask that question so vaguely anymore. I'm asking, do you use any nicotine type products including vaping? Usually that gets a lot of responses because vaping is a nicotine, and we actually think it's a little bit more dangerous than cigarettes because
Oh yeah,
you're
there's
just
no
puffing
filter.
as you're
Right, right.
going.
What about Mary Jane?
Mary Jane, so pretty
Mary
much Mary
Jane.
Jane, this guy. So overall, there's really no data to suggest that it will increase heart problems. However, it does show some correlation with potential increase in depression. And then in that regard, you probably will not engage in physical activity, which would then probably lead to a
Got it.
cardiovascular
Okay,
event. Yeah.
got it. So if you're smoking weed but you're using a cigar wrapper to smoke the weed, does that how does that impact?
So there's still some level of nicotine in it. So there's still some dangers in it. Probably not the same as when you actually smoke a cigarette by itself, per se. But yes, there are some dangers associated with it.